Good morning, good afternoon, good evening, everyone. Welcome to our today's webinar on security for decision makers. My name is Sobelo. I work as a senior technical advisor at PATH in the Digital Square Initiative. And with me today will be with Nino, who will be leading the discussion today. So a little bit about Digital Square for those who are new here. Digital Square is a thriving digital health marketplace, or a square where supply and demand come together to accelerate health equity through the development, adoption, scale, and delivery of digital health innovations. And this initiative does this by aligning investors and government bodies around a shared digital health vision, which is based on country needs and priorities, and also working with regional and country bodies to strengthen the national level digital health governance to support country digital transformation, as well as promoting the development, adoption, and reuse of digital global goods for health. And a little bit about this session today. So it is going to help you understand how to consider security in the era of digital health. And Nino Harris, who is our technical security architect, is going to share his expertise on cybersecurity and why it is important for decision-making roles beyond the technical aspects. So in this session, we'll explore the opportunities, the challenges, and practical issues that decision makers face in their journey towards improving their cybersecurity. Some housekeeping rules before we get started. So the webinar is going to be recorded and will be shared on our wiki. We welcome you to revisit the content and share with the colleagues from the wiki. Also, questions and comments are welcome using the chat functionality in Zoom. Even during the presentation, you can post your questions on the chat. And a little bit about Nino Harris. So Nino is an entrepreneurial, spirited, and pioneering technologist with years of cybersecurity. He is currently at Digital Square as the technical security architect. A seasoned professional, Nino has executive level experience in identifying, qualifying, building consensus for, and implementing enabling technologies and enterprise systems that facilitate business processes and strategic objectives. He has broad expertise in cybersecurity, IT, computer forensics, network, programming, and telecommunications. Architecture, infrastructure design, complete project lifecycle management, client vendor relationship management, and financial operational management. And Nino believes that a powerful blend of technology vision and business acumen results in the consistent development of robust business strategies supported by cost-effective, high-performance IT infrastructures and applications. Now, over to you, Nino. The floor is yours.
Great. Thank you so much, Sobelo. Fernando, no, it was basically waiting for the speech from my colleague, Sobelo. Hello, everyone, and welcome to second part of a series of webinars that will concentrate on cybersecurity. And it's not just technical, especially today is more in term of you as a decision maker, or if you are involved in any decision making within your organization, now, future, that doesn't matter. How would you go about understanding cybersecurity? What questions you need to ask, where you need to consider? So this second part today is not going to be technical in a form of that. If you guys were here to learn some of the tricks in world of cybersecurity, but do not worry, we have planned for so many more of these webinars, which will come in future. Now, today's agenda, we're going to have an overlook of cybersecurity and how it will impact the way that decisions are made, risk and consequences if we don't really pay attention to cybersecurity. And believe it or not, often people will say or will think that I'm not a target for hackers. Why should I go and invest? Because it's not going to be cheap. Often we might think that, investment in cybersecurity is a short term and it's going to have just it will require limited budget in money. That is not true. That is a fallacy. This is where we're going to look at the true cost of cybersecurity and true cost of what if you don't pay attention to cybersecurity, how it will damage your reputation, what financial impact it will have, the concerns that, and especially in the world of health, digital health, how this will impact the patient data and patient at the end. Legals and regulatory landscape of cybersecurity, especially the one that are covering digital health in general, organization security awareness, the culture, basically. Often we would say there is a policy we all sign, but how are we aware of security related element within our organizations? What trainings do we need? Have we learned anything from our colleagues, from other digital health providers and people who are working on the same field? Different type of cyber attack, which one you might face according to, it is a little bit geopolitic, to be honest, this one. The attacks that we see in West are a little bit different in comparison to, let's say, African continent, Far East Asia, Middle East, and so on and so forth. Some real example and impact of those attacks and some of the best practices that are out there that you could apply to be able to make sure that you are safe and secure, at least 80%. Don't worry about 100% because often that is not possible to achieve. But if you achieve 80%, I will be very happy. Now, before we dive into cybersecurity, data privacy, and all of that, we often talk about the CIA triad and why it is so crucial and important because, well, your business wants to make sure that everything that you access, your customers access, your users are accessing, it is all confidential, that it is not basically, a data that could reveal a lot of information, especially with sensitive data of health that we are dealing with. We also want to make sure that the integrity of this data is preserved. If you access data, if you access a computer, a website, and if by any chance this is modified, it is changed, and the integrity is no longer there, how would you trust this platform? Let's say if you go and buy a car, how do you know if it is from the same brand that you are paying the amount of money that you have? It has to have a way that it shows the integrity of this equipment, the application, the data is all there. We also want to make sure that data and services are available. At the end, if you have best and the most beautiful website out there, but it is not available, it is pointless. This is whole idea of CIA triad. We also add the element of non-repudiation. Basically, if you create a software, if you create a car, an engine, a door, window, whatever it is, I have to know and I have to have this assurance that it is from you. How do I tell? Well, basically in a world of digital, this is where we have certificates, and your certificate will give me this assurance that the application is designed by Microsoft, by Apple, etc., etc., etc. And cybersecurity will try to preserve the CIA triad, including with the element of non-repudiation. Now, we have often heard the two words, cybersecurity and data privacy, and people often go and mix them, to be honest. They think it is the same concept. It is not. They are separated, but they are basically hand in hand to make sure that we preserve the privacy and safety of data. You have patient records, you have financial records, all of that requires to be protected. And how do we provide this protection? By applying privacy rules, regulations, and policies. And with help of cybersecurity, we will basically try to make sure that data is protected. In a short term, if I would explain what privacy is, basically what we try to protect. And security is how do we go about protecting what we are trying to protect. Let's say if it was a laptop, data inside this laptop requires privacy. To be able to make sure that this data is protected, we apply different security measures, locking the laptop, for example, using antiviruses, and so on and so forth. In a world of health, because there are a lot of regulations that will force us to do certain stuff or not to do certain stuff, it might become an issue. Now, I want you guys to hold that thought for a few seconds. Because in some cases, regulations are really good when we follow them, but it becomes really a pain when you don't follow. And by let's say coincidence, a chance, or an event, somebody comes and knocks your door and say, hey, you haven't followed any regulations and now it is time to pay the penalty. That's why regulations are good when you follow. Regulations are really bad when you haven't followed. But I would always say regulations are wonderful to follow because at least it will tell us the basic of where exactly we want to be. More on that as we progress, I promise. Now, if we look at the complexity of modern business and organizations, everything is basically interconnected. Digital, non-digital doesn't matter really. Clouds, on-prem doesn't matter, but we are heavily relying on this interconnected ecosystem of everything, from emails to mobile devices to IoTs, bring your device, management of network, backup. You go to clouds, you go to systems that are isolated and they are not connected anywhere, but somehow they are orchestrated and using OTs and so on and so forth. When we think how big this whole entire ecosystem is, this is where it becomes crucial to understand where exactly is it that we have to make sure that when it comes to cyber attack, we will preserve and protect. A cyber attack in a sort of short term, if I try to explain, is when somebody does something that they shouldn't do that in the first place. When a system, a code, or something does something that it wasn't supposed to do. And often it is not a hacker that it will compromise the system. Always bear in mind that often we think a cyber attack is often external, but we ignore the internal threats that are out there. It could be, by accident, I will delete something. By accident, I will bring down a system. By accident, I will change somebody's level of access from a normal average user to a higher level of access. Those are all part of cyber attack, as in form of understanding, to basically to categorize them. Now, the impact will be different, obviously, if an external threat comes in, or even an internal threat that will try to compromise the CIA triad of your organization. In some cases, we will see the impact could be very massive, with paying over $10 million for a data compromise or a cyber attack. Or it could go to millions and millions, to be honest, depend really what organization was targeted and for what reason. Now, you might ask yourself that, well, I don't have anything. I just, we are doing good stuff. I'm an NGO. There isn't that enough budget. Why should they hack me? I don't have really valuable data for hackers. This fallacy, I've been in the world of cyber over 20 years, and every organization that I have been involved, they often think that they will not be compromised. They will not be hacked. Even individuals, you talk to your friends, you talk to your colleagues, they say, oh, I just have a laptop. So what, even if they compromise it? But there is always that element of control. At the end, when somebody tries to hack your system, your ecosystem, your organization is about controlling your ecosystem, the whole computational power of your digital devices. If we look at where things are at the moment, we would see that 41% of attacks that we are seeing out there are ransomware attack. 27% of current hack that we see are insider threats. You have attackers that based on political views, religious views. There's competition. There is cyber war between countries. There is an angry user. Let's say today I'm not happy with Path because somebody said something wrong, and I'm just going to say, oh, I will reveal a lot of info from Path environment. And obviously there are some unknown motive. Somebody comes and by chance they will get inside your environment because you haven't followed basic principle of remaining secure, and they are in, and you are an easy target in this case. If we look at health information, I know you might not see that because the screen is too small, but don't worry, we will share all these slides and you guys could go into detail to see where exactly things are standing. If you look at healthcare, majority of attacks that we are seeing is often when a privilege of data is misused. Let's say I'm a doctor, let's say I'm a nurse, and I'm going to access other individuals, other patient data, or other health facilities data that I wasn't supposed to see in the first place. Although this is mainly Western countries that we are dealing with according to this data. In other developing countries, let's say Asian continent, African continent, majority of cases, most health environments are compromised, and these environments are used for e-mining. bit currencies and e-mining currencies. In West, it is often ransomware. Data is encrypted, users have no longer access to the data or to equipments that are operating inside a health facility because they are encrypted. This is where the health provider facility has to go and pay money to be able to get the key to decrypt those data. But you see variety of this type of attack from different parts of this planet to other different parts. So what I'm trying to say is, do not think that you are immune just because you do not have solid data for some bad guys who they will try to compromise. As I mentioned, even a simple compromise of your laptop is an enough reason for me to think about hacking your system. So what are the consequences of a cyber attack? You might say, well, I'm just going to go and format my laptop and don't think about anything major that has happened. If you look at a larger picture here, an ecosystem of an organization, we're talking about financial loss. Even the time that it requires you to go and format your laptop and reinstall everything, it is time consuming, it is adding money into the operation. Loss of sensitive information, disruption of operation, obviously regulations and legal bodies that we had to follow, but we haven't because now the system is compromised. There are consequences that we need to pay. Damage to reputation. Let's say if I had a company called Nino.something, it is compromised. Now the user comes and says, or in most cases, the Ministry of Health comes and says, well, your system was compromised. How do you want me to trust the system and use this system within our network? Patient mistrust of health facility, as I mentioned, health minister or government entities will come, or even the donors will come and say, well, hey, your system was compromised. Why should I trust this system from now on? Now, element of risk. You have to really, this is where a decision maker has to understand to ask right questions. Because at the end, you are going to make a decision, and this decision will take time. It will require cost and human resources to be able to answer those questions. We have to understand what are the threats outside there. Is it internal? Is it external? Are we dealing with government entities? Is it private entities? Is it a single hacker out there? What are the vulnerabilities that we have inside our environment? I know you might think that it is only digital, but please ignore that. It could be physical. It could be a third party that you guys are dealing with and you guys are having business with, that they are basically not paying attention to cybersecurity. Would that be a vector of an attack that comes and somebody will hack a third party and will come back to hack you? There are often a lot of stories that we see out there. What is the likelihood of this vulnerability being exploited out there? Let's say I have a building, there are plenty of doors, windows, and I have never paid attention to see if they are really compromisable or not. But now I know they are vulnerable. Somebody could just break in. What is the likelihood of that? Well, my building is in a part of the country that it is not safe and secure, so it could be that the likelihood is very high. What would be the impact of somebody compromising and gaining access to this building? Well, they might go and set fire to the whole entire building. So you would see that impact on the business could be massive. And when I use the word business in a lot of slides, it doesn't have to have a business that privately generates money, especially in our field. We are basically dealing with NGOs, donors, and all of that. But at the end, that will also have some cost, because if you haven't paid attention, what will happen later on, you're going to pay for the damage that the cyber attack has caused, and now you are going to fix that. Now, a decision maker will often come back and say, so, oh, Nino, you talked about cybersecurity. It's very good. It's fascinating. How much is going to cost us? And just to have this number in back of your head, I would go between 15 to 20% of a budget for a project that has to be assigned for cybersecurity. I know it might be a lot, but we often push for at least 20%. More better, but in some cases you would say, no, I just have 15% that you could go and invest. But it has to be a right investment. When we are going to invest 20% or 15% of our budget in security, what exactly is going to offer? I could come and say, let's go and spend $2 million in buying one of the best firewalls out there. But then later on, you're going to come and say, well, actually, the cost of my website is $50,000. So it doesn't make any sense. And it does also have to to provide this element that when you try to plan for the budget that relates to cybersecurity, it has to provide appropriate security for the core of business. I will come back to that in next few slides. We will be efficient in our security management when financially we are trying to plan. One thing that I also want you guys to bear in mind, cybersecurity shouldn't be an enabler of what your business is going to offer. Because often you hear that, an organization comes and says, if we apply that in security measures, then we can enable this. It shouldn't be like that. Your business, the core of your business is running, and cybersecurity will make sure, or the cybersecurity team will make sure that the system is not going to be compromised, is not going to be quickly compromised. And this is where we try to manage relations with suppliers and all of that with the appropriate cost that it has been budgeted for cybersecurity. Now, customers are important to pay attention to, reputation-wise, governments, Ministry of Health, and so on and so forth. In operational term, what are the requirements here? Do we have enough human resources? Can we execute all of these plans that we have? What will happen in case that the system goes down or if it is compromised? Do we have enough resources to be able to say we will recover from this event? Like as an example, I'm based in the UK. A couple of years ago, the NHS system here, the National Health System, got under attack with a ransomware. To be honest, it took them over a few years, and I've heard that they are still not 100% back to where they wanted, because a lot of that data that was encrypted was already gone. Learning and growth, obviously, we always learn from our mistakes. We will try to be better prepared with better investment in long term and short term. Doesn't really matter. Now, you will ask yourself, what exactly are we trying to protect? You really have to understand what your business have, what your ecosystem is made of. You need to understand your assets. This is where the inventory list of everything that you have. And to be honest, I cannot emphasize enough on this matter how important it is when it comes to cybersecurity. When you have a proper inventory list of everything that you have, every asset that you have, it will make it much easier for somebody like me to come and tell you how would you go about protecting it. You would know which asset will add what value to your business, and that will make it much easier to do a calculation when it comes to a risk management. You want to identify the asset, you want to identify the value of those assets, and I will go one by one through these 5 elements. Document the impact to your business if any of those assets are compromised or damaged. Also think about the likelihood, and I will give you guys an example as we continue on this few slides, and also prioritization of the mitigation and activities that you need to apply to make sure your system is well protected. Because in some cases there are vulnerabilities, there are issues within an organization from 1 to 10. But there are few that are prioritized based on how valuable and how important they are within an organization. So what exactly these assets are? Everything that you have. Could be an individual, could be a building, could be a password, could be a file, could be a third party, could be a network. I don't really know. You should know that. It is your business. And an inventory list of every asset will help us to make sure that what exactly you have. I have worked in so many places that they really didn't know what they had. You would go and ask question, you would go and find a machine, you would know that somebody has password, access to password and data, and then you would say, well, that was not written anywhere. There were no records of that. Now, just imagine that you're going to create a file, an Excel sheet as simple as that, or a table that will have all the name of these assets that you have. Patient information, devices, password, third parties, anything and everything. That could go on and on. It could take about few months, few years, depend on how big the business is, how big the ecosystem of that organization is. Identifying the value of the asset. You are the only one who would know what value an asset will have within your organization. A computer for me might only have the physical power or the computational value. However, I wouldn't know what exactly it is operating or what it does within your ecosystem. You will come and tell me, for example, oh, by the way, this is the database of all our patients. The whole entire value goes to the roof. It might not have a tangible value. It might have few numbers added to it. You would say, well, the value of this machine is $10,000. However, the value of data, because it is generating X and Y, is in range of 2 million or 3 millions. Now, this is where, remember on the first column, we had all the assets we have. Now we are going to assign the value to of those assets. I have an individual called Nino. He's holding all passwords from the organization. The asset of this value called Nino is very high within organization. Now, it doesn't have to have any monetary value to it, but as long as you know where the assets are within your organization, it is quite crucial. What would be the impact of those assets within your organization if they are damaged, compromised, and so on and so forth? Well, Nino is sick today. He's not coming to the office, and nobody else has access to those machines, and now the system is down. You will see the impact is massive. Now you have to think about, how would I shadow Nino? How would I go and hire somebody else who will do the same job as Nino? And how would I monitor those activities and make sure that the system will continue operating the way that it's supposed to? Now, you would see that we have added another column within our table that will tell us what is the impact or the damage to any of those assets within our organization. Now, the likelihood and the loss or damage to the asset. Well, what is the likelihood that I might not go to office today? It could be very high due to illness, due to traffic. Could be my car is broken down in the middle of the highway. I don't really know, but we have to give those elements some chance of possibilities. Well, it is very low that you might not be able to get into the train, bus, drive your own car. So let's just assign a low value to this one. Or it could be that illness, because you have somehow a history of a lot of illnesses, that could be very high, very medium, and so on and so forth. Hopefully you guys will see how a table like that will help you in understanding where exactly you need to invest correctly. Now, finally, we are going to identify and prioritize potential solutions. Now, Nino was this guy who had all this information, but I have Cervello. Now, Cervello has worked with Nino for a couple of months to be able to bring down this impact or the likelihood of this impact that Nino will have within business. I have made that smaller, but actually I will give you guys another example here. Let's say I have a laptop that I will take this laptop with me to go to work. What is the chance or the high likelihood of this laptop being stolen while I commute to the work? Well, it is very high, you know, just because I take public transportation, London is crazy, and so on and so forth. How can I minimize that? And is it a priority to go and minimize that? Even if somebody steals this laptop, the impact will be bare minimum, low, medium, and so on and so forth. Well, I can decrypt the whole entire data. Sorry, I can encrypt the whole entire data, or I could just segregate part of, you know, data that it is related to the work and encrypt that data. So even if laptop is stolen, now the chance of bigger impact is lower in comparison. That table will help us to see where exactly the priorities are and what is the impact here. So if the impact is high, what is the likelihood that something will happen? How can we make those that with high impact and high possibility, turn them into lower or medium? Not always this is possible, but at least you would know where the vulnerabilities are and how would you try to mimic a pattern to be able to protect in a better way. Let's say if there was no way that you could protect the laptop, and you would say, I will still give a 20% chance if this laptop is stolen. Okay, let's just deal with the high risk. Let's accept the high risk, but we are going to make sure that if the laptop is stolen, remotely we can wipe every part of data within this laptop. A table like that, basically this whole idea of a risk metrics, will help us to have a better view of where exactly things are standing. And this is where regulation and frameworks often help us. Like recently, I was involved in a project that I'm not going to mention the country, but their idea was, how can we come up with our own regulation and framework when it comes to data protection, data privacy for health environment, for Ministry of Health? I have no issue with that, that if you go and you will say, I'm going to design my own regulation, my own framework. Well, the difference between regulation and frameworks are advisory, regulations are mandatory, and we have to follow them. The reason that I wouldn't recommend you go and design your own regulation or framework, because majority of the frameworks that you guys see here, from GDPR to HIPAA, PCI DSS, and so on and so forth, they have gone through rigorous check and a lot of testing and a huge investment behind them, and often they update. So they have gone through many scenarios. They know what exactly they are doing in most cases, and this is the reason we often go and say, let's just follow that. And you don't really have to. If you are regulated, you have to follow those. So let's say if you are dealing with customers' data in European Union, GDPR is a must. But if you would say, no, actually, we're just going to have a look at GDPR to see what value it will provide to our business. Very simple. Just go and handpick whatever is matching to your system and ignore the rest of it. As simple as that. But don't redesign the wheel. Reinventing the wheel will not help. It will just require a lot of time, and then you will discover at the end that you have developed something that is very similar to GDPR, because at the end, the way we deal with data and cybersecurity in many cases is very similar. So now, why regulations? Well, a regulation will go and cover these 4 elements of making sure that it will help you to identify elements, protect those elements that are identified, detect any threat that are associated with your elements, respond to those detected cyber attacks, and helping you to recover. I will go in detail here. Now, a regulation such as GDPR, let's say, or ISO standards that is used in a lot of places and a lot of countries, it will help you to develop an organization understanding to manage cybersecurity risk that will help you to identify assets and capabilities regarding how would you protect those assets. It will also make sure that you are applying correct measure of safeguarding those assets that you have. Let's say you have a database. Majority of this regulation will help you to understand how would you protect, from encryption to segregation of duties to providing anonymization of data, tokenization, and so on and so forth. It will also help you to understand how would you detect if a system is compromised or under attack. Often we don't really know. You know, if you ask me, how do you know if you are hacked or not? I have no idea to tell you if I'm hacked or not. I cannot tell you if I'm compromised or not if I don't go and invest to see where I might be able to detect if somebody is compromising my system. This is where constant reading of data, constant analyzing of events is very crucial for an organization. Developing a way that we respond to a threat. Okay, few computers are hacked. A part of our virtual LAN is hacked. What exactly are we going to do now? Do we have to go and unplug the whole entire system? Are we going to stop machines that are talking to each other? Is it Savelo's account, for example? Let's just go and disable that. Is it Nino's account? But it will help you to understand where an attack is detected. How would you respond to this attack? And when it comes to recovery, how would you make sure that the recovery is as many percentages as possible? It will never be 100% when it comes to recovery, because, well, we cannot really do a backup of data 100% on that moment when an event happens or when system is compromised. You're going to lose few percentages, but how big that percentages is, it will become very important. I would say anything in a range of 90%, I will be very happy with recovery. I will come back to that recovery later on, I promise. Now, the whole entire element of following regulations and why it will help us, I have put that in this slide. Hopefully you guys have access to this slides later on, and it will make it much easier to understand. In asset management, governance, risk assessment, business environment, this is all part of identity. Information protecting, processing and procedures, maintenance, management access, awareness and training, all comes part of protection, and so on and so forth. That will be much easier to understand. Somebody has mentioned NIST is something found quite, it is really, really good. Gurpreet, I hope I have pronounced your name correctly, but it can also become overwhelming because it is really massive. And that's why I would often say to people, don't panic. If you see a framework such as NIST OWASP, STMM, BSI, and so on and so forth, that they are page after page. Just go for those that will basically fit within your system and apply those. And often I would say 20% of NIST framework guidelines will apply to one organization at a time. So that's how it will be. Now, if you guys remember, I talked about healthcare data and how it is regulated. Overly regulated, and there is a reason, because information data that is exchanged or stored within eHealth is really crucial, is really important. You are most welcome. Now in West, an average, when a breach is happened, because regulation will force a lot of this still upon an organization or an eHealth facility provider, the cost is over $10 million. In some other countries, we don't see that cost, because they are not following any regulations. However, the costs come at the end. How would you respond to an event, to a cybersecurity event? Regulation and industries that are see the long tail of costs, as you guys can see, health is often on top with 10 million that it will cost. Common type of cyber attack in health sector, I've already mentioned that: ransomware, phishing attack, denial of service and distributed denial of service, malware attacks, an insider threat, social engineering attacks, and so much more. To be honest, there are lists and lists of attacks that are out there. In average, for an entity to understand if they are compromised, you will see that healthcare are the longest that it will take. Over 226 days, if I'm not mistaken, that it will take for a health facility / a Ministry of Health to understand if they were compromised or not. Yes, they will be shared, those slides. Now, what is the reason that healthcare is so behind when it comes to detecting and identifying a breach? Could be lack of investment, could be because there are so much different data that is collected. They are dealing with devices, legacy devices that are not really protected well, and so on and so forth. So how would you be able to protect yourself in a better way? Be prepared. Just by hiding your head in sand doesn't mean you are safe and secure. This is where you need to invest. Go zero trust. Zero trust will deal with identity access management, segregation and segmentation of network, device security, data security, and constant monitoring and analytics of what is going on with the network. Security automation. Now it uses the word cloud here. I have to really be careful with, I know, because some of us are forced to stay on-prem, some of us are forced to go to clouds. I don't know which one you're going to go and which one is better, because I'm not inside your ecosystem. This is where your cybersecurity team has to have these capabilities to tell you which one would be the best option. You also need to think about money and all of that. So secure implementation, this is where, as a decision maker, you also have to understand when a system is there, how would you make sure this is all implemented securely? This is where experience of proper admin guy, network guy, cybersecurity, HR, physical, the rest will come and will help you, that everything will help you to understand everything that you have as an ecosystem is correctly protected and implemented. Now, you might also think about security assessment, or it could be that regulation will force you and say, hey, Savello, because you are following HIPAA, you need to do a security assessment. Penetration testing, often this is called, but penetration testing often refers to assessing digital environment. It doesn't deal with social engineering. It doesn't deal with physical. It might, but in most cases, people will often think about how would you go and do a security assessment or a penetration testing of a digital environment. If it was up to me, every 6 months, I will do a security assessment of the whole entire ecosystem. If time, budget, human resources allows, obviously. If not, at least whenever there is a major change, I will go and try to do that. Identifying asset, it could also help with that. Threat modeling, we could use different type of modeling. NIST could be one of those. OWASP, doing a vulnerability assessment, penetration testing, risk assessment, and so on and so forth. How to conduct a security assessment. As a decision maker, somebody within cybersecurity team comes and says, boss, we need to do an assessment. Well, you have to ask them, have you defined your scope? Are you using the right tool? Individuals? Have you collected correct information? Have we done our inventory? Do we know the vulnerabilities? Have we discovered all of that? Is it been reported before? Have we applied any mitigations, or is that the first time that we are doing that? There's also some elements that we need to avoid as a security assessment, or whoever is going to make a decision about security assessment. You have to prioritize what exactly need to be assessed. It is an expensive affair. It's not a cheap one that you will say, I'm going to hire Nino and he's going to do an assessment. I could charge about $3,000 a day. I'm joking, but you guys get the point that it is going to be expensive. If you have many pen testers, assessors, and third parties, because by regulation, you cannot mark your own homework, you have to go to a third party. You make sure that they will not do any unauthorized testing, leaving any trace of testing behind, neglecting compliance, disclosure of any information that they have discovered. They ignore physical, they ignore the human factor. The weakest element inside an organization is always the human element, because we are very complex machines. Now, managing user privileges is really crucial. And often we see that type of behavior in certain environments, certain countries, that everybody wants to be an admin. But what I always go and say is, you make sure that your environment, that it is designed, it is all segregated, and every segregated element is also monitored. I don't have to be an admin. You don't have to be an admin. Somebody doesn't have to access to this database. This is where we control user privileges through mandatory access control, rule-based, role-based, discretionary access control, even physical access control. Why are you visiting this data center? You shouldn't be here. Just because your job is cybersecurity, it does not give you this permission. This is where segregation of duties is really crucial. At least you are going to tackle two elements with segregation of duties. An insider threat that will not go and jump from one machine to the next one. And also, if somebody inside is compromised from an external point of view, that individual or that account will not have access to other part of data or the ecosystem of our organization. This is where it is really crucial. Now, third-party security concerns, we deal with third parties. So you have to have concerns to see how secure and how safe they are. Are they protected? Are they well protected? Are they misusing data? Do they have an insider threat that I have to be aware of? Lack of oversight because they really don't share a lot of information. Compliance, for example, ISO, I think it is 9,000 something with ISO when it comes to third party. PCI DSS has its own approach, HIPAA has its own approach, but this is where you need to ask a lot of questions. Path, you are coming to work with us in certain project, and we are going to share data with you. How exactly do you guys go and handle data security and privacy? I have to show you, I have to demo what exactly I have to make sure that your decision will be much easier. You would say, for example, this guy called Nino from Path is not really following any regulation, but we have Savelo that it is following HIPAA or PCI DSS or GDPR. Let's just go, because they will understand where the security and where they should pay attention to security. This is where we do a thorough risk assessment of a third party. We have a clear security requirement to say, Savelo, you need to provide that. Sophie, you need to provide that. Nino, you need to provide that, and so on and so forth. Conducting a due diligence. Do they care about this stuff? Establishing and security sharing agreement, signed. Make sure that they are not going to abuse data that you are sharing with, especially health data, that it is very sensitive and very valuable. Regularly review and monitor third-party security postures and what they do within your environment. If they have access to through VPN to your environment, what exactly do they do? IT team, cybersecurity team, HR, doctors, nurses, everybody, they have to really understand what is going on. Now, I promise that I will come back to backup strategy, because it is going to be one of the most important defense line ever. If you do proper backup, you are always 95% sure that even if something happens, you will come back and stand on your feet and be able to recover a lot. Now, the 3-2 policy, 3-2-1 policy is really important. So 3-2-1 backup strategy. You will have 3 copies of your data on 2 different types of media. It could be USB, DVD, CD, tape, whatever it is, and at least 1 offside of your data. So 1 different location. 3 copies, 2 different type of media that we store this, 3 copies, and at least 1 offsite, which is going to be somewhere else. Those are going to be the policies that I will follow when it comes to backup. And that was it. Thank you so much for listening. And questions and answers, I'm going to hand it over to Cervello, and I hope you guys will have some questions. I want this to be an engaging session that we will ask some important questions to see how we will protect ourselves. Thank you so much.
Yeah, thank you so much, Nino, for this wonderful presentation. So I can read from the chat questions about the slides. So these slides will be shared and there will be a recording for this. And I think a notification will go out when this gets posted on the Digital Square Wiki. So a question from Daniel Rosen here. What approach is needed for data protection different from cybersecurity? What approach is needed for data protection different from cybersecurity?
Hi, Dan. Good to see you here. Now, when it comes to data privacy, I think it is most crucial to understand the data that we are collecting follows a regulation to be able to make sure that this data has the element of privacy associated with it. Let's say data is tokenized, it is all anonymized, data is shared, it is all basically chopped into pieces and nobody makes sense of that data to reverse this data for some other needs. We have to have the reason to collect that data. We have to have I know it sounds very GDPR here, but those will help us to at least highlight the privacy of that data. Now, how do we achieve the privacy of that data? By making sure that the correct security measures are applied to protect that data. This is where we talk about IDSs, we talk about LDPs, we talk about proper authentications, we talk about intrusion detection system, intrusion prevention system, data loss preventions, encryption, proper encryption, making sure that encryption is used when data is exchanged from one node to the next one. That will help us to have these two approaches for the same goal, which is protection of data when data is all in a form of privacy measures that are protecting that data. As I mentioned in first few slides, cybersecurity is how we are trying to protect the data that we are trying to make sure that it is all confidential and the integrity of that data is all preserved. Further to that, to be honest, I will have a data officer to understand the value of each set of data that it is handled, stored, even deleted for long, after whatever the entity is doing with that data. Those will be some of the approach that I will apply. No, let me just go through some of the questions in the chat.
Yeah, another one here. I find the 15 to 20% of budget dedicated to data security very high for donor-funded programs, yet the risks are what? Yet the risks are real.
The risks are real.
How else could such program achieve this without this level of investment?
We had that argument, Linda, this conversation when we were in Malawi and in Tanzania. And I'm afraid it has to come from the donors' point of view. They have to push for that. I know it is a lot. You know, when you ask for 20%, 15% of budget to go purely for cyber, but this will change as more and more we see that individuals, organizations, and NGOs and projects that we are involved are getting hacked discriminately without any concern about data. Sooner or later, decision makers, donors will also come and say, well, we need to also invest in cybersecurity. This is where cultural change requires. This is where whoever is introducing a new project, they have to understand that security has to be part of that. Otherwise, if you don't, sooner or later, you're going to go and pay even more than the 20% just to fix because somebody is using a ransomware on your system. I know it is a long call. We are still way off to be able to achieve that. But I'm hoping in 5-10 years time, we will have a better understanding, at least also from the decision makers, to come and say, if you are going to apply a project or do something, security has to be part of that. Hope that makes sense. Any other questions?
Thanks, Neil, for that. And then another question, should we be still promoting or using standards like ISO, which is bloated, slow to update and catch up to new kinds of threats, and never evaluated properly in practice?
Yes and no. That's why, if you remember when I said just handpick whatever is fitting to your system. If by regulation you have to follow ISO, I'm afraid you have to follow them. But if you would say, I'm going to go and make sure that security is properly done within my organization, let's go and look at some of these frameworks or regulations. Go with the one that you feel it fits much better to your ecosystem. So let's say if NIST is the one that covers a lot, if ISO is covering everything, do so. I know they are slow. I know it takes a lot of time for them to come up with new update and so on and so forth, but at least it will give us a unified approach to cybersecurity. This is where, if you have enough expertise within your organization, I would say go with their expertise. They will tell you how to do a proper job. But if you don't have that, and you would say, okay, we're not going to reinvent the wheel, where should we start? ISO will be a good start. If it is web environment, OWASP, Open Web Application Security Project, BSI from Germany, OSTTM, you name it. There are plenty that are out there. Take the longest to identify. Let me just read that question from Carlo. Yeah. You mentioned that the health sector has the longest security breaches, 200. Yes. Is there data for the frequency of number of how many of those breaches occur? Unfortunately, we do not have that, Carlo. And that was a survey done. I have the references with it, with the slides that goes in, and mostly Western countries that they have released this information. We don't really know what breach was. In most cases, ransomware is the ideal attack from a hacker's point of view for the Western e-health providers, but I cannot give you the granularity of what exactly going on there. Any other questions?
Yeah, let's see this from Goprit Luthra. It's more of a comment.
Sorry, somebody else was on mic. Hold on. Somebody was on mic. I heard somebody's voice.
Hi.
Go on, yes. I can hear you.
Can I
yes.
ask a question?
Of course.
Okay. All right. So GDPR has been forefront in terms of.
Could you speak up? I lost your voice.
Can you come closer to the mic, please?
California. Can you guys hear me?
Yes.
Hello?
Yes.
Okay. So GDPR has been a leader in terms of defining privacy. Since then, California.
You are breaking up, Matt. You are breaking up.
I am sorry. Let me see if I can switch this to
now it's better. Now it's whatever you have done. I think after coughing, it got better.
Okay. All right. So get back again. GDPR is great leadership. Mm-hmm. California has just adopted some privacy of their own. Several other states are doing the same thing. The same thing is happening around the world, mm-hmm. Including African countries too. Are you seeing what I'm seeing, which is each country will have their own privacy regulations that dictates in that country? And how are you approaching this?
Yes, and yes to all of that you said. It is exactly, and that's what one of the concern was, to be honest, that recently, as I mentioned, one of the countries that I cannot name the country had this sort of their own approach to data privacy. And it was a very mini version of GDPR. And my honest answer was to them, well, since you guys are copying and mimicking GDPR in this light version, go and analyze to see if it fits your system. Now, the issue here, Matt, is they think about privacy and they are trying to apply, let's say, GDPR without having a proper infrastructure ready for it, without really having a better picture ready for it. Like in most Western countries, I would say, when it comes to identity management of individuals, we have different systems. Like, in UK, we have an address, date of birth, and so on and so forth that will make sure that you are who you are, or the passport number or national security number, whatever you guys call. In African continent, we don't really have that. And now they are trying to make sure that the identity is private, is is all protected, and they use fingerprints to make sure this identity is also confirmed. So it adds other elements to it because the infrastructure in the first place is not ready. But that doesn't mean to ignore that. I think GDPR, when it comes to handling data, it covers a lot of elements. Like in the UK, we have another version called DPA, Data Protection Act, which is another copy of GDPR, but they have changed and twisted somehow, because in UK, we always want to say we have our own stuff, but it is very similar. And I don't have any issue if you are using GDPR, Data Protection Act, or the California Data Act, whatever it's called, as long as the systems that you are using or you're trying to enforce these regulations as policies are also ready to handle that, because it will also introduce other issues. Let's, as an example here that I mentioned, if you collect fingerprints and you don't know what will happen or the consequence of those fingerprints if they are compromised, or even data associated with those fingerprints, it can become another issue. This is where they ignore that. In Kenya, I had a team from another country, and they were very proud of collecting fingerprints to make sure that the patient records are correct. And my first comment was, why would you collect fingerprints? Because now it's going to add more issues to it. I hope that answers your question.
Thank you.
No worries.
Yeah, thank you so much, Nino, and thanks everybody for the questions. We are coming to the end of our session. So today's webinar was looking at security for decision makers, and thanks, Nino, for this great presentation. Next, coming up, we will have the data privacy and security for developers designing and creating digital health systems. And in this session, we will explore the security implications of modern code development and deployment practices in health systems. And our cybersecurity experts journeys the developers into producing clean and maintainable code. So the next session, the next webinar will be more focused on developers. What should developers be doing as they're developing these digital health systems? And not really specifically digital health systems. I would say any systems that we are developing as developers, what security considerations should we put into place? So watch out for an invite from Digital Square. We will share that through our normal channels, and you'll be able to subscribe and a date will be fixed. We do not have that for now. And once again, thank you all for attending this, and we welcome you to our next webinar. All details will be shared on the Digital Square Wiki. Feel free to share it with others who are not able to make it to this. And thank you until next time.
Thank you so much.
Bye-bye.